Can you please tell me your name, your credentials, and your current position?
Sure. My name is Karen Shepard. I have my master's degree in nursing education, and I'm the simulation coordinator here.
What strategies do you use for incorporating and implementing teamwork with your students?
Let me think about that a minute. It looks differently as a simulation coordinator as it would somebody who is a classroom teacher or maybe a clinical instructor. But we do a lot of teamwork in simulation. A specific example I can think of is we have a simulation that's a multi-patient NCLEX simulation. So in that simulation we have nurses designated as a charge nurse, a registered nurse, LPN, CNA. We use different roles, and they have to collaborate and take care of a whole team of patients. We don't do that till we start that their junior year. The learning objectives are a little different because we repeat that same simulation as seniors with different learning objectives. So we kind of start them off small of just working together as a team to manage their daily care of a bath, their daily care of giving them their medications, their assessment, and just kind of delegating those things out. So that's just kind of how we focus that as juniors. Bring them back as seniors. They see the same patients again, but the focus is different. So they still have those things that they do in their junior year to work as a team, but we kind of increase the difficulty of the patient where they have complications, and so there has to be a team that's a rapid response team that would come in and take care of those complications. And we also give the charge nurse, I call them charge nurse challenges. So they have to think of whatever that challenge might be, how am I going to fix that?
Sure.
And sometimes that involves that team that they're working with of, okay, we've got a staff member who is, the challenge is they have a child who's sick at home and they have to leave. So you bring that team together in a huddle and just say, what can we do here? How can we rearrange our staffing?
Sure.
We're going to, they're in charge of how they're going to do that, but they also give the team a voice of what works best too. So that's just one really fun teamwork activity that I can think of that we do with the juniors and their seniors.
Awesome. It sounds like very close to real life
It
in
is.
nursing. So that's awesome.
And you will see that with simulations I do here, they're based off of real life. It's either something that's happened to me as a nurse, or if I talk to graduates, they're telling me oh, Mrs. Shepard, I had this situation. I'm like, thank you. I will incorporate that in a simulation. So teamwork too, I think, just in simulation is just like doing the SBAR. So getting that physician involved, so interdisciplinary team, whether that's the doctor or whether that's a dietitian or physical therapy, we will let students kind of play that role. But that role is designated as this is what that person would do, this is how they function, and this is what I want you to say. So that's another way that teamwork is added into our simulation.
Yeah, that's awesome.
Does that answer your question?
Yes, thank you.
Okay, you're welcome.
My next question is flexibility is an imperative skill to have as a nurse. How do you teach your students about flexibility in nursing practice, and how do you remain flexible as a nursing educator?
Okay, so two different questions there. How do I teach flexibility to our students? One thing I think is we address it. We just talk about as a student, you need to be flexible with deadlines. You need to be flexible with, we are teaching you something one way, but now we're going to change it and do it differently. Even though we're very structured, we have a content outline, but we even say in our syllabus, be flexible. Things may change. So that's just as a student, but teaching them that way as a student. I think the other way as a nurse, when I think about in here, when we do a simulation and when we do debriefing, you can tell students who are just very rigid in their thinking and they're going to keep doing it this one way, and just saying, okay, now step back, and if you could have an open mind about this situation, if you had a little more flexibility here, and just kind of debriefing that and calling them out on maybe the unflexibility,
Sure.
And then saying, well, how could you be flexible in this situation with this patient who, even though you know your objectives are to give medications, X, Y, Z, but your patient needs to do this, how could you have accommodated that? How could you have been more flexible in that situation? So when those arise, I would say it's probably not always intentional with the flexibility of teaching them here, but we identify it,
Right.
and we see it, and we kind of talk about it in debriefing. It's a little different in simulation versus teaching in the classroom on the
Sure.
subject of flexibility.
Right.
But my goodness, if nurses aren't going to be flexible, they start with a plan, and that's one thing that we do teach in here.
Yeah.
It's like, you're a nurse, so it's like, okay, this is a patient you're going to take care of today. Develop your plan, and they have one, and then we always say, like, and they, especially if they've been in simulation for a while, like, it's not going to go as planned. But that is teaching them flexibility. It's
Right.
like, I had a plan, but that plan is going to the wayside at the moment. I've got to be flexible here and adjust. So they're learning that in simulation.
That's a great way to teach that in simulation.
Yeah. What was your second question, though?
How do you remain flexible as a nursing educator?
I think one thing is I have to remember what it was like. I've been a nurse for over 30 years, so sometimes I think, well, how do they not know?
Right.
But I just have to go back to erase everything I know, every bit of experience that I've ever had as a nurse, and think like them. They're reading it in a book.
Yeah.
They don't have experience. They cannot tie those words on a page to what an experience would be like. So I think for me, like, how to remain flexible is just like, remember their little blank slates. Remember that maybe their slate's not completely blank because we've been writing on that slate, but look at where they're at and just going, okay, my role here is not to judge, but it is to look at where are their gaps, where are the holes, and how do we fill them, and then get them to the level that they need to be at. So,
Yeah.
does that answer your question?
Yes, it does. Thank you.
I heard that beep. I just want to make sure it's still going.
Oh, I think that might have been your email
Oh,
or
okay.
something. I think we're
I'm
okay.
glad you know. I'm like, I just want to make sure we're still going here.
So what is the biggest challenge you face with time management as an educator?
Repeat that question one more time.
What is the biggest challenge you face with time management as an educator?
So I can think of this when I was as a novice educator and now, and there's a difference. So as a novice, the hardest thing as a new educator for me with time was, how do I manage 50 minutes of classroom teaching, because that's how I started. So that was the hardest thing for me, of managing time in a classroom, just classroom management. It was hard. And I didn't realize that. I just thought, okay, I've got to deliver content, and then you realize it's like, I've got too much content in a 50-minute period of time. But I think now, as I think about time management, because honestly, as an educator, it's different than being a nurse in a hospital. Like, I'm going to work 12 hours, I will punch in, I will punch out. With nurse education, I mean, with a computer at home, with books at home, you could work almost 24/7, especially as a novice. Like,
Right.
I need to know more. I've got to know it all, and that's a trap that new educators fall in. I got to know it all. They're going to ask me these questions, and I'm not going to know it.
Yeah.
Now I can look at that and go, I've been a nurse all these years. I've been a nurse educator all these years. I've never even thought about that question. So I like and appreciate your question. Let's make that question may not be relevant. You go find that answer and bring it back to me, and let's see, is that question worth everybody needing to know?
Sure.
So that goes back to time management, where it's like, I don't have to be up all night trying to think of every scenario and situation that a student might ask me. I can be honest and say, I don't know. A lot of it too is boundaries. So when you're in an academic environment, it's not just the nursing program. It's committee work. It's whether that's through the nursing program or if that's with the school, it's like we need to be on a committee, we need to do this. It's just having the boundaries to say, no, I can't do that at this time.
Yeah.
So, does that help?
That's the very good advice.
Okay,
Yes.
good.
Okay, our next question is, tell me about a time when you utilized your communication skills to resolve a conflict or a problem in your career.
Okay. Well, I can say as an educator, my career as an educator, thankfully there hasn't been a lot of conflict. There hasn't been a lot of things that needed resolution. As I think about, what would a conflict or what conflicts have I had as an educator with a student, I can think of probably some categories or that students might be upset or it's a conflict is maybe unfair grading or that the assignment that was required was too much. And so it's not that it's conflict, it may be more of a student complaint.
Sure.
And I always think, okay, is that student's complaint, is it valid? Think about, what's the return on investment for that assignment that was required for simulation? So a pre-sim assignment, did that help the student learn? Was that too much time?
Yeah.
3 hours of prep for a simulation, is that too much? So I know it's not conflict, but maybe it's a resolution to a problem of they don't have a lot of time.
Sure.
And especially here when they have to work 15 hours a week on campus, and we require 900 hours of clinical time, so they have a lot of clinicals every semester, almost every semester, that they might have a valid complaint. And I hate to use the word complaint. It's really not conflict, but I need to look at their point of view, and that's how it would be with a conflict. What is their point of view? What is my point of view?
Sure.
And then let's talk about both points of view, and then let's try to resolve that. Let's try to meet in the middle if we can. Some things you can't meet in the middle. There are some assignments, if that's the issue, there's a reason to it, and I'm sorry that it requires those many hours, but there is a point to that you should learn from it so that you can be successful in the simulation, because that simulation is going to be based on a real life experience that you need some type of information coming into before you do that simulation. So luckily, I can't say that I really have had
that's great.
conflict or something that needed to be resolved. That's about the best I can come up with.
That's a great answer.
Okay.
Great answer.
Good.
My next question, what motivates you as a nurse educator? And then additionally, what do you consider to be the most valuable skill you can have as a nurse educator?
Okay, so let's answer that first one. What motivates me as a nurse educator? I've been at this position for 17 years. And so when I first started as an educator, it's leaps and bounds. There's just this big, gaping, it needs a bridge from being a nurse at the bedside to being a nurse educator. And it was tough at first to make that leap, big leap, jump. But I started to realize I liked being an educator more than I liked being a bedside nurse. Because at first I didn't. But I had to figure out kind of maybe what motivated me to be an educator. And it was the students and their success and the light bulb going off. There's nothing more fun to see is when that student nurse is like, oh, I get it.
Yeah.
This is what we talked about in the classroom. I had an exam over this. And then in simulation, we're going to apply that. And they're like, oh, that's why the answer to that test question is that. Or that's why the book talks about that. I get it.
Yeah.
And then they take what they've learned here and then they translate that to clinical practice. So that really motivates me, is to really prepare them in the simulation for what they will see in the clinical setting. And it's really exciting to see them come back and say, Mrs. Shepherd, like everything that happened in that simulation is what just happened to me today in the clinical setting. I'm like,
Yeah.
yes, that's what we want. So
Yes.
that's really what motivates me, is just preparing the student to be successful in the clinical setting.
Yeah.
And just translating knowledge that's
Mhm.
from a book and seeing that applied
Right.
in the clinical setting, and the light bulb just goes off.
Yeah.
There's
That sounds
nothing better.
exciting. Yeah.
There's nothing better. So
So the second part of that is, what do you consider to be the most valuable skill you can have as a nurse educator?
it's a valuable skill. So that means I'm supposed to pick one thing, and I don't think I can. So I'm going to kind of go at that from two sides.
Okay.
I'm going to think about like the character side of a
Mhm.
person, like what's required. And I would say patience
Mm.
is probably the number one soft skill that's needed, is just be patient, listen, come alongside the students. I think that is the soft skill that's needed for this job.
Sure.
I think when you think about the cognitive, intellectual, academic side of thing,
Mhm.
like what is the priority, it is continual learning. While it could be a frustration that things are continually changing in nursing, like we have evidence that proves now that this is the best way to suction. So we just had a situation come up where a year ago we were teaching, as I learned, intermittent suction. Like when you're pulling out that catheter, if you're deep suctioning a tracheostomy, that's intermittent suction. And then that has changed just this year. So you see it different in a book, you see it different in the video. And if we're not continually learning as an educator, then we are teaching students not evidence-based practice, but last practice.
Right.
And again, it could be a frustration, but I do feel like when you're continually looking at best practice, that is what is required of us to be really good educators, because we want to send the student out with the most up-to-date, reliable,
Right.
evidence-based best practice. That's really our goal. It needs to be. Now, the problem that can occur with that is the student goes to the clinical setting and they see it done the way it was done last year,
Right.
or 5 years ago, or 10 years ago. So there's just, I could talk all day about the gap between education and practice.
Right.
And a lot of times education is ahead of practice because we're held responsible to know
Sure.
what's the latest, hopefully the greatest, that's based on evidence. That's where we've got to get to, is evidence-based. But then they go to clinicals and they see that, well, they're doing intermittent suction. Well, of course they are, because they have not had any updated information from the hospital, because that's not our job, that's theirs. And so then they see that and kind of have to wrestle with what they see versus what we've taught. So what I'm talking about is kind of going a little bit off subject of what you're speaking of, but it's we always tell the students, like, we are teaching you from this book according to the most most recent evidence that's out there. Now, your goal is go pull the policy, go pull the book, whatever, the manual, whatever it is, where you're working, and you're held accountable to that. And I don't know what that is, because it's going to be different at each hospital. And I can't teach you everybody else's policy. I have to teach you what is our most recent information. So I guess that does relate to
absolutely.
the relevance of, you know, what it is that what we need to know and be to be the best at what we're doing. So
those are great observations. Okay, so that is our last question. So thank you very much.
Well, you're very welcome. I've enjoyed answering your questions, and I really hope it helps you in your pursuit of being a nurse educator and getting your degree. So
thank you.
Thank you for asking me.